Ready?
Okay.
All right. Good afternoon, everyone. We'll go ahead and start. So, welcome. My name is Vishwanath. I am the director for the Lee Kumshun Center for Health and Happiness and a professor here at Harvard T.H. Chan School of Public Health. It's such a delight to have all of you and those of you who are on the cyberspace on Zoom or Panopticon or whatever. So Panopticon, not everybody's realizing what it is, but you can look it up. This is a first in the series of our seminar series for the center. As we began reimagining some of the foci of the center in the new era, one of the things we wanted to focus on, most of the focus on for the Center for Health and Happiness has always been, whenever we say happiness, people focus on individual happiness, and sometimes psychological well-being and mental health. But we have been trying to pivot a bit more into what does it mean about promoting happiness, well-being, joy in a community setting, in a more collective well-being sense. And so we wanted to deliberately shift this focus exclusively on individuals to more social connections and social well-being and social health. Different terms are used by people. So when we discussed these things internally in the center, we felt strongly that, and we also felt that translation should be strong. And how do we solve some of the wicked problems, so to speak, social problems, from a sociological perspective. And one of the biggest problems is loneliness. I think Surgeon General has highlighted it, but it's just not the Surgeon General. I think globally there is a lot of attention to the phenomenon of loneliness, and which is an irony. Loneliness in the age of digital media, when we all seem to be online all the time. So we began looking for, so this year's seminar series includes this theme on loneliness. And as we look at the speakers, of course, Dr. Julianne Holt-Lunstad's name came up immediately, given her seminal work. I have been a big fan of her work ever since she contributed a chapter on social support for our book with Drs. Barbara Reimer and Karen Glantz. We have I'm a co-editor with a book from them. And when we asked people around, okay, who should we ask to write this chapter on social support? Again, her name came up. So I've been a big fan of her work for a long time. And over the last few years, her work on loneliness has been seminal. She's one of the few people who is not only doing very contributing original scholarship and the evidence base to study loneliness, but actually trying to influence policy at the national and global levels. So she's a professor of psychology at BYU, but that's only one of many roles she has. She's a prolific contributor to the literature, but over the last few years, I think you testified in Congress and working with WHO, working with the U.S. Surgeon General, and a variety of foundations and organizations. So I couldn't be more pleased and delighted that you managed to come here. I know how busy you are, so welcome, Julianne, and please share your ideas with us. So thank you for coming. As she's coming up, usually we do it at the end, but in the spirit of Center for Happiness, I will express my gratitude at the very beginning, right? Otherwise, people are leaving at the end. Everyone's rushing out. I want to thank two people who were instrumental in working with me in organizing this. Anubha Tyagi is the Assistant Director of the Center. She has been doing a lot of work behind the scenes. People who work behind the scenes don't always get the credit, So thank you, Anubha, for all the work. And Gala, who is at the back. She's hiding behind that pillar, but you will see her taking photographs, and she will be posting on social media and I don't know where else. You have to be very careful what she will post and where. And I want to thank Ayla also for the work. So thank you, everyone, and thanks for coming.
Thank you. And thank you, Vish, for all of the work that you did, and thank you so much for inviting me. Truly, it's such an honor to be here today. I am also going to start by acknowledging and thanking people because, of course, everything that I'm going to be talking about today was not done in isolation. So, of course, I want to everything that I'll be talking about today I want to express my gratitude for those that directly contributed to this work or whose work informed this, and those, of course, who supported my work. There have been many studies, including studies done right here at Harvard, that have examined what brings people happiness. And although there are a variety of studies, consistently what we find is it's not necessarily success or wealth, it's our relationships. And study after study shows that relationships are often at the top of the list of what brings meaning and purpose to our lives. And so it's a bit of a truism that people don't truly appreciate what matters most in life until it's taken away. And it's clear that the global pandemic brought greater awareness for the importance of social connection for our well-being. But of course, this is not a new issue. And it's not specific to the pandemic. We, of course, have decades of scientific evidence across multiple scientific disciplines. In fact, many here at Harvard contributed to some of those seminal studies. But the pandemic was important for a few reasons. It clearly tested us, and it found us falling short. We were not prepared. It simultaneously exacerbated existing problems of isolation and loneliness. It revealed gaps in our evidence and understanding. And it challenged our ability to mobilize in a crisis. As a result, people suffered, our community suffered, and ways that go beyond, of course, COVID-specific health effects. And so because there were concerning trends around social disconnection already prior to the pandemic, certainly getting back to normal is not going to be enough. And so we truly need greater effort, and this is an opportunity to act, or the long-term consequences may be far-reaching. Globally, we have seen responses to the crisis of isolation and loneliness, including my own work with the recent Surgeon General's advisory. But it's also clear we need to move beyond crisis mode operations to efforts that build social connection that are more sustained. And so we need to ensure that individuals and communities aren't just surviving, but actually thriving. So this advisory not only calls attention to the potentially serious consequences of loneliness and isolation, but also offers a path forward through a first ever framework for a national strategy. So my remarks today are going to be somewhat high level, focusing broadly on what we know, what we don't know, or what we still don't know, and where we need to go from here. So it's a culmination of some of my own work, the work from the larger discipline, as well as highlights from the Surgeon General's advisory. And I just wanted to highlight that an earlier version of this advisory was informed by multiple agencies and organizations, It was reviewed by more than 50 external subject matter experts, and we adjudicated nearly 1,000 reviewer comments. So this was like peer review on steroids. Now, I'll be the first to admit that it is not exhaustive, and in fact, it is less than half of its original length. But considerable effort was made to represent the evidence in a way that was accessible to the public. So this advisory points to the evidence on social connection as a critical and underappreciated contributor to both individual and community health, well-being, safety, resilience, and prosperity. So on average, people who have strong social connections are happier, healthier, and live longer than those who don't. And while many of us in academia may be well aware of some of this scientific evidence, the public awareness of this is somewhat lagging. And so, unfortunately, far too many people lack social connection in one or more ways, compromising these potential benefits, leading to poorer health and negative outcomes. What's interesting is that the public perception is that isolation and loneliness are a result of the pandemic. However, we have evidence, including this evidence from the American Time Use Survey, that showed that some of these declines were started long before the pandemic. So here, across 2 decades of evidence, we see increase in time spent alone, decreases in household family engagement as well as non-household family engagement, less time with friends, less time with others, and less time in companionship. And so as we can see, this started long before the pandemic. Of course, we also have data that dates back even farther, decades prior to this, showing additional kinds of declines on various measures of social capital. So it's perhaps not surprising that by at least some estimates, roughly 1 in 2 American adults report experiencing loneliness. As I just talked about, there are many ways in which people can be connected or can lack connection. And so one of the more challenging tasks of the advisory was defining terms. We've got different disciplines that are using different terms to mean the same thing, and sometimes the same term to mean different things. And so it's clear that we need a common language. Unfortunately, the public seems to have used the term loneliness as a catch-all term. So it's colloquially used as referring to, in essence, any kind of lacking social connection. When in academic studies, we have a much more narrow, specific kind of definition. More specifically, it's the unpleasant subjective perception that arises from the discrepancy between one's desired and actual level of connection. It's important to note that that is just one way of lacking social connection, is that perception or that signal. There are other ways in which that may occur. And so as we think about, of course, both loneliness specifically and greater lacking social connection are both important. However, because loneliness is much more narrowly defined, we do need to be somewhat careful, because as there is increasing emphasis on loneliness, it may influence what gets measured and what gets intervened upon. And so as we approach solutions, we may narrow the scope of what we do. So what do I mean by social connection? Even that you'll find different definitions places as well. But the way I define it is because of the cumulative scientific evidence that has emerged across multiple scientific disciplines and a wide range of measurements, I use social connection as an umbrella term that can be broadly categorized into three key elements: the structural, functional, and quality of social connection. So the structure referring to roughly the existence of relationships and roles in our lives. The functions, in essence, that needing people that we can rely upon to serve our various needs. And then, importantly, quality, recognizing that not all relationships are entirely positive, and we need to pay attention to the quality of relationships. Each of these have been found to be predictors of important health outcomes. But unfortunately, they're not highly correlated. And so what this suggests is that each may be contributing to risk and protection in unique ways. And so when we need a simple, broad umbrella term, social connection, can serve as an umbrella term such that high levels of social connection would be associated with low risk, whereas low social connection would be associated with high risk. So one major lesson that we can learn from this is that social connection is critical to our well-being. But again, the general public primarily associates this issue with emotional well-being. And even despite the increased awareness with the pandemic, it's considered to be a mental health issue. But we know and have evidence of a broad range of outcomes pointing to social connection as a core public health prevention strategy with potent ability to influence a variety of kinds of related health outcomes and risks. So the advisory, some of my own research, and as well as decades of interdisciplinary research, is based on the premise that humans are a fundamentally social species, and that this social need is reflected in our neurobiology that can shape our thinking, our behavior, and functioning. So for example, evidence points to dysregulation across multiple biological systems when various social needs are not met. And of course, if this is sustained over time, this dysregulation can lead to the development or greater risk for disease. So the social environment, both early in life as well as into adulthood, is one of the strongest predictors of morbidity and mortality across social species in nature, including humans. So in addition, experimental studies across these species show that social interactions can causally alter physiology, disease risk, and lifespan itself. So in my own work, we gathered the available data worldwide, including data from over 3.4 million participants. And when initially healthy participants were tracked over time, those who experienced deficits in social connection, namely isolation, loneliness, and living alone, were more likely to die earlier regardless of cause of death. More specifically, loneliness increased earlier death by 26%, isolation by 29%, and living alone by 32%. Just, I think, in the last month, a new meta-analysis has come out with 90 studies. They must have had a more narrow inclusion criteria because it was a smaller sample, 2.2 million people. But consistent with this, both loneliness and isolation were independent predictors of mortality, although social isolation was significantly stronger predictor. In an earlier meta-analysis of 148 studies examining the protective effects of being socially connected, we found that social connection increases odds of survival by 50%. So this data has been replicated in, there's now many meta-analyses, many reviews, systematic reviews, umbrella reviews, and that have generally replicated these findings, although the effect sizes may vary across these. And so, but what we can see from this figure is that when we benchmark these social factors as depicted in the orange bars, relative to the effect sizes based on meta-analytic or meta-analyses on other risk factors for mortality, that they are comparable. And so what this suggests is that our social lives may be just as important for our health as these other factors that often get prioritized more attention, more resources in public health than has this issue. Now, I do want to have the caveat that, of course, there are limitations to benchmarking, as well as what I'm presenting here there's newer data that we need to include. But I did want to, I chose to include it because I also wanted to highlight some of the data that we have, even on social factors, that they, in and of themselves, vary in their magnitude across these risks. And so what I think is particularly noteworthy is the kinds of indicators that are associated with assets of social connection generally have stronger effect sizes than those that are focused on deficits of social connection, pointing to where we might want to point some of our efforts. So another major lesson is that we can take from this is that social connection is critical to survival. And of course, this goes beyond deaths of despair, and it goes beyond just loneliness specifically. We also have good data that social connection influences various health outcomes. And in interest of time, I'm going to skip over this because I'm guessing you already all know this. So I'm just going to note that while we have growing evidence around some of the pathways for which these kinds of health outcomes can occur, understanding these pathways in greater detail will be important for us to understand points of potential modification or intervention. Where I think there has been somewhat less attention is on the, as Vish was talking about earlier, much of the attention has been focused on individuals. And yet we know that there's evidence that social connection benefits communities as well, and that this is a community and societal issue as well. So some of these benefits range from population health, including things like evidence on the spread of illness, including COVID responses, evidence looking at aspects such as violence and safety. I thought there was a really fascinating study that showed that more connected communities had a 21% reduction in murders and a 20% reduction in car thefts. But there's also evidence pointing to community preparedness and resilience. And I want to take a moment just to emphasize this because several studies are showing how important social connection is in times of crises. So whether that's a personal crisis, such as losing a job, or larger kinds of crises, such as natural disasters, including floods, fires, earthquakes, a heat wave, a pandemic, a war. This research shows that communities that are more connected and communities where people know each other, this can be a matter of survival. Communities where people know each other are more likely to be better prepared for, respond to, and recover more quickly from natural hazards than those with lower levels of social connection. And I think this is particularly noteworthy, especially as we're seeing extreme weather patterns becoming more frequent. And that more connected communities are going to be essential to weathering these kinds of environmental crises. So another major lesson to take away from this is that although I highlighted just one, there are many pressing issues in the world today. And we should not see prioritizing social connection as something that is distracting from that, but rather may help us address some of these other kinds of pressing issues. I also want to recognize that, of course, this is more than a personal issue. And that a variety of factors can influence how socially connected we are. And it's easy to view this as a personal issue because, of course, it can feel very personal. But we know, and if we draw upon the socio-ecological model, we can understand that a variety of factors can influence this, whether they're personal factors such as one's own personal health or financial strain, to the kinds of interactions they have with others in their home that might be supportive or sources of strain, to the extent to which our neighborhoods are safe and walkable or provide spaces to gather. Each of these can be a potentially underlying cause of isolation or loneliness, but each of them can also be sources of that we can tap into for solutions. So we do need to think across all of these levels. Given some of the evidence around a social gradient, it suggests that with each unit of increase in social connection, we might see reductions in risk. What that suggests is that each of us are somewhere on this continuum or hypothetical, normal curve. And so, of course, targeted approaches to reach individuals who are at high risk are needed. However, tertiary approaches are often the most expensive and the least successful. So even if they are successful, we are potentially reaching the rest of the population. So we're only affecting a small portion of the population. So we also need societal level kinds of approaches that can focus on some of the protective effects of social connection that could potentially shift that entire trajectory in a way that helps reduce risk at a population level. So easier said than done, right? When we think about just our own health and what we prioritize for our health, we often think of diet, exercise, sleep, maintaining a healthy weight, right? We need to add social connections to that. So how do we do that? Well, we take these things seriously because we have national health guidelines for many of these things. It's what is taught in health curriculum in the K through 12 public health education. It's what's emphasized in preventative kind of visits with our healthcare providers. It's also what's emphasized in public-facing kinds of health promotion resources like this one. And so we need similar strategies to add social connections to that list. And we're starting to see some of that, including the inclusion of social connection as one of the pillars of lifestyle medicine. I recently published a piece on the evidence supporting national health guidelines for social connection, outlining what the process might be to establishing those, as well as offering potential examples of what that might look like. It's also one of the recommendations in the Surgeon General's advisory. And it is also something that Canada has already started, and so there's an international effort. So unfortunately, the US is already somewhat lagging behind. So I want to emphasize, I know I mentioned it before, but I'm going to emphasize it again. This is more than a personal issue. And the pandemic, I think, clearly helped illustrate this. And it taught us two really important lessons. First is that external factors can influence our level of social connection. Secondly, social connection is part of every aspect of society. As we experienced when there was policy aimed at limiting social contact, we saw how this changed every aspect of life. How we go to school, how we work, our transportation, how we shop, our entertainment, and so much more. What this clearly demonstrated is that social contact is relevant to every sector of society, and that every sector of society can potentially play a role to either facilitate social connection or to become barriers of social connection. And so one of the pillars in the Surgeon General's advisory is connection in all policy, and recognizing the social implications of each policy. And so what this requires is a whole of society approach. We need to go beyond individualistic or even just health sector kinds of approaches, but a whole of society approach. And so my colleagues and I developed a model that we refer to as the Social Connection Framework, social being an acronym for the systemic framework of cross-sector integration and action across the lifespan. Yeah, mouthful, right? That's why it's just social. At the beginning, or at the center of this, of course, we have the individual, but it really, this model takes the socioecological model by acknowledging that the individual is embedded within relationships, communities, institutions, and society. And so it builds on this by overlaying the health and all policies model, recognizing the relevance of every sector of society. In addition, it builds upon these two well-established models by recognizing the important contributions of collaboration between these different sectors and the opportunities for potential outcomes. It extends it even farther by recognizing several cross-cutting themes. And so in no particular order, this acknowledges the importance of recognizing the modality of how we connect, and that they may not all be equal. That there are important distinctions across the life course, and that it's relevant across all stages of life. That we need to be sensitive to equity and inclusion as we think of each of these contributors, and that there needs to be research and evidence across all of them. So because this is already looking pretty complex, pretty messy, tried to create something a little bit more useful and simplified by creating this kind of a grid system, so that the levels of the socioecological model are the green columns and the sectors of society are the blue rows, and where they intersect, those cells are numbered so that we can systematically identify where we have evidence or gaps in evidence and where we have opportunities for solutions. And so what's unfortunate is that if we look at this, most of our efforts are really in about two of these cells, at the individual level in the health sector. What that suggests is that there is about 95% untapped opportunities here that we can accelerate progress in this area. And so one of the things that is so important about these untapped opportunities is that this has the potential to significantly influence population health and well-being in ways that have not adequately been addressed previously in national public health discourse or strategy. So it's clear that the efforts are not independent, and that coordinated efforts are needed across research, across policy, across practice, and across social infrastructure. So in my work and my role as the lead scientific editor on the Surgeon General's advisory, we tried to incorporate this into a framework for a national strategy to advance social connection. And so this includes 6 key pillars, which include strengthening the social infrastructure in local communities, enacting pro-connection public policy, mobilizing the health sector, reforming digital environments, deepening our knowledge, and building a culture of connection. So one thing I want to note is that while we can develop all sorts of programs and policies, if our social norms do not support them, they will fall flat. And so the norms and culture of how we engage with one another can significantly influence social connection. And it rests on core values of kindness, respect, service, and commitment to another. It sounds pretty idealistic, right? But we do know that research is examining pro-social kinds of approaches. I want to highlight just one that I was involved in, and I'll go very quickly through this. But my colleagues and I did a randomized controlled trial. It included nearly 4,500 people, so thousands of participants, and they were randomly assigned to a kind challenge, and half were a control group. People were simply asked to do small acts of kindness for their neighbors. It could be something as simple as checking in on them, seeing how they're doing, or offering some kind of practical kind of support. It was very simple, and yet the results were quite striking. The acts of kindness significantly reduced loneliness, stress, and conflict with neighbors, and increased their likelihood of knowing at least 6 of their neighbors. So, of course, we know that the kind challenge is just one approach, and multiple approaches are needed, including very systemic changes in communities. But it does provide some attractive components that other types of interventions may consider. First off, it was rigorously tested through a randomized controlled trial. It required few or no resources. Literally anyone can do it. It required no training at all. It was flexible. People could do it in the way that felt comfortable to them. And it was scalable. But again, this is just one effect, and in fact it was a small effect, but on scale might have larger kinds of impacts. So I just want to conclude by highlighting the importance of deepening our knowledge. So Pillar 5 of the advisory suggests that we need to deepen our knowledge in these areas. And so this helps us recognize not only where our strengths are, because in some ways we have a lot of evidence that the public is just simply not aware of. But then we also have many gaps in that where there are opportunities and priorities that can occur. So we have converging evidence across multiple scientific disciplines, despite the fact that we have so much variation in measurement. And so this helps us think about prioritizing multi-factor types of assessment approaches. We also have lots of validated tools, but unfortunately, because there are so many, it makes comparisons across time, across samples, very difficult. And so standardization, at least at the national level, can help establish and track rates. We have evidence of a dose-response kind of effect across the lifespan. However, most of the attention is focused solely on those who are considered to be extreme risk. And so we need further kinds of work across the risk trajectory, and importantly, across the life course. We also have strong and converging evidence across the different components of social connection, and yet few of them actually measure them in the same sample. And so it's difficult to, so we need more evidence in which they're in the same sample so we can identify the independent, additive, and synergistic kinds of effects, which will help us to more precisely assess risk. Okay. Also, we have good evidence on mortality, but we have fewer studies on some disease kinds of outcomes, as well as fewer studies on underrepresented groups. And so we still need some basic research to fill some of these gaps. We also have good evidence of the effects on health, and yet weaker evidence on how to actually mitigate the risks on that. So we need to prioritize that. And then finally, we have robust evidence on some of the mortality and some health risks, but less evidence on other kinds of outcomes, including things like economic outcomes, civic engagement, education, et cetera. So I just want to conclude by saying one of the big lessons I've learned is the importance and challenge there is in translating this all. I have the tightrope because it is a very fine balance in trying to maintain academic and scientific rigor while recognizing the importance of the practicality, both in terms of communication of the science as well as the interventions. We need the public to be able to understand this evidence, and we need policymakers to be able to understand this evidence if we want them to act on it. And so with that, I thank you.
Maybe we'll take one or two questions. Go ahead.
Always good to start with gratitude, so thank you for that wonderful talk. Also, welcome back, because you may not recognize it, but you have been in this room before, projected on that screen in the Loneliness in Public Health course that's taught here every year in the summer. So thanks for coming back, and thanks for leading that course, starting before the pandemic. And that'll be taught again, HPM 561 this winter. Okay, so that's the gratitude part. But I'm also curious, particularly around the increasing visibility on loneliness, the role of the media, not of science, but on the media. Because many people will not find their way even to the beautifully crafted HHS report. Great to know where it got written, that you wrote it. Fantastic, thanks for that. But finds it in articles or how it's covered on the radio and so on. And what's your sense of whether the media is doing the best job possible in taking science and making that information available effectively? Or are there other things the media can be doing, other strategies and so on?
Yeah, I mean, the media, I think, plays an important role because that's where most people get their information. And so, it's interesting because many academics never will even speak to the media. And so that, the more that scientists and those involved are willing to communicate with the media, I think that helps us share our knowledge and be able to communicate our knowledge. And of course, there's also a role in terms of shaping awareness as well as shaping some of those norms, because what gets repeated often is often what's viewed to be most important, as well as somewhat of a reflection of what is concerning to the general public. And like it or not, it's also a significant influence on our politicians and leaders that often make really important decisions on our behalf. And so the media play an important role.
And the second part of the question is, how good a job do you think they're doing, and are there things they could be getting better?
Well, of course, we know that some do a better job than others. And we know that Vish is involved in some work on misinformation as well. So we know that is the case. And so on the one hand, they do a really great job of putting what might otherwise be really complex information into plain language, simple to understand kinds of information. But there's sometimes when they clearly have an angle that they want, and they're trying to fit the evidence into that angle. And so, in part, it also depends on the source of media. And and as I'm thinking about this, I'm thinking of journalists, but of course media is so much bigger than that. and so I just want to acknowledge that media includes, television, movies, what's included on social media, the websites. It's so broad, and so there's so much potential there. And I think one of the things that I was really honored to participate in is the National Academies of Science partners with an organization, and I'm blanking on the name right now, but they help to bring together scientists with people in the media to ensure that much of what they're communicating is science-based. And so it's a real opportunity, I think, to ensure that information gets communicated appropriately. Yeah.
Great. 30 seconds. I think some people have to go to classes. Emric, go ahead.
So earlier you mentioned that the loneliness epidemic was a downward trend of social connection before COVID arose. Do you remember maybe potentially seeing warning signs of this happening? Like I remember seeing through the 2010s as a teenager, it seemed like the loneliness epidemic was impending. Do you remember seeing warning signs, and do you think it's feasible to be able to use that kind of 20/20 hindsight to kind of predict extra future challenges for social connection?
Oh, so interesting. I'll try and make it really quick.
Sorry.
First off, there are so many different metrics about how we can measure those trends, right? And so just even thinking about it, even if we just looked at that, time spent in isolation, which is different than loneliness, it's different from other things, but just hypothetically, let's, just use that for one example. We saw, of course, a spike, an exacerbation with the pandemic, but it didn't begin there, right? We also saw a spike around the time social media got introduced. And so, but again, it didn't start there. And so, we have to look back even farther, right? And so there are many factors that are contributing to this. We know we had evidence of concerning trends even prior to this. Just for example, even if you look at the attention and concern, the UK appointed their minister for loneliness well before the pandemic. And so, there was already growing public concern of this well before that. So in part, we need to look, at prior trends and try and give us kinds of clues. But the other thing to keep in mind that I do have real concerns about is the fact that on the heels of the pandemic and we have shifted dramatically in the way in which we engage with our world. We are far more remote now. We're working more remotely than ever before. We have learned to, as humans do, adapt, right? And we've learned to be comfortable in isolation. We've learned to, get our food delivered, get our entertainment at home. I worry that people have become so comfortable that it takes more work now to get out and be social, get into our communities, be active in our communities. And so I am concerned about what are the long-term kinds of trajectories of risk that might be occurring as a result.